Health Minister Dr. Aaron Motsoaledi has announced that 1,200 doctor posts, 200 nursing positions and 250 other healthcare positions have been approved by the department at a cost of 1.78 billion rand. The issue of unemployed doctors has sparked concern, with many unemployed doctors protesting to demand jobs. Organizations have also called for government to provide employment to doctors who have completed their community work. With the announcement that the Rural Health Advocacy Project has called on the Health Department to ensure that the staff are distributed evenly between urban and rural areas to ensure that healthcare needs of underserviced populations are also met. To talk about the plight of people in rural areas who are in need of access to healthcare, we're joined now by Rural Health Advocacy Project's Executive Director, Russell Rensburg. Russell, very good evening to you. Thank you for your time. Some good news for the country's understaffed health department. I suppose it will be an important matter to ensure that there's a sense on how the new staff members will be allocated across the country.
No, absolutely. I think it's a very welcome announcement. I think after almost since 2012, we had very limited budget increases to allow for this. So it was quite encouraging when the finance minister suggested that he would add at least 800 new healthcare workers. So it's quite significant that the minister and the MECs have now, the MECs for the provincial departments of health have now agreed on this large number of additional healthcare workers, which is long overdue.
What will the boost in staff mean for the country's overall healthcare goals? The unemployed doctors who we've seen staging, picketing, protesting, expressing frustrations over unemployment, and other healthcare personnel.
I think first and foremost, the country is experiencing a significant health challenge at the moment. We'll all know that in January 20 earlier this year, the 47th President of the United States made some announcements and suspended essential aid to healthcare in South Africa. So these announcements off the back of that will go some way to alleviating the plight of the 15 to 24,000 healthcare workers that are operating in the space and are very important in achieving the goal of reaching 1.1 million people living with HIV who are currently know their status but are not in treatment. Similarly, the 200 nurses or so would also go some way in addressing the gap of almost 2,000 nurses that are left. But where exactly the doctors and the nurses and other healthcare workers will be placed is now a matter that should be open for dialogue and discussion. Given that we have so many different priorities, we have to make sure that the staff is ultimately deployed in the areas where they can make the most impact. And right now, the response to TB and HIV are critical to maintaining this country's overall healthcare goals in the short term, at least for the next 2 to 3 years.
Yeah. Minister Motsoaledi also named the 10 members of the review committee that had been appointed to look at the human resources policies in the department to perhaps understand which policies were no longer needed or had become obsolete. It's a commendable move, but there are some grey areas, aren't there?
There is, the largest one of that, a policy that served rural areas quite well over the years, is the requirement for newly qualified doctors to spend a year in the public service doing community service through ComServe. That could be a policy that could be reviewed given the financial environment that we're in. We also know that in the budget announcement, Treasury made some conditionalities that they required health departments to do. And this looked at things like remunerated work outside of public practice, which is very important, but also sometimes abused. So there's a need to relook at those policies and how those policies are managed. Thirdly, there's the policy on commuted overtime. There's an argument, for instance, by adding new doctors and nurses into the system, it mitigates the need for people to be doing 60 hours overtime per month and in such a way allow for the employment of more doctors. But it's a very esteemed panel. I think our only gap at this stage is that, rural interests and community or healthcare user interests aren't fully captured within the very well-qualified panel. But it would do well to maybe add something with a community insight, also some necessary skills around health technology assessment, particularly around prioritization, because these are many posts, but they're few in the larger scheme of things. So how they get deployed will be an important part, a role for this task team to deliver on.
There are also some questions around how the gap of the 15,000 frontline healthcare workers who were previously employed through funding from the US government will be filled. I mean, that in itself, yeah.
No, we're particularly concerned about that. You know, currently the country has launched two bold strategies. The first one is obviously to find 1.1 million people living with HIV that know their status that are not in treatment. The second one is a 5 million target for testing TB, which means that we can have a better chance at finding the 66,000 people who contract TB each year but don't access services, and then in turn contribute to 56,000 deaths from tuberculosis, which is the most deadly disease in South Africa. Now, those healthcare workers are not included in this lot. You know, maybe some of the nurses or doctors could be deployed, and that's certainly something we would recommend. But the posts that we really need to get these campaigns going are some of those posts lost through PEPFAR. And these were primarily lay counselors, community health workers, data capturers, treatment adherence club coordinators, and the like, you know, so very on the ground, very embedded within our clinics. And without replacing them, we really we have a very, very difficult chance of actually meeting our short-term goals of enrolling more people onto HIV care, finding more people living with TB and putting them on treatment, and reducing deaths and overall health outcomes over the long run. Then we also have over 1 million babies that are born in the public sector each year. And that experience of delivering a child in the South African public system, because of understaffing in some of those units, can be a very harrowing experience. And this is probably one of the areas, given that we have such a young population, with close to half of the population now under 35, many of them will be considering having their children, and we need to really make sure that that experience is a lot better. And when we look at the numbers, in rural areas, investments in maternal and child health services are particularly important, because while overall we are achieving better outcomes for maternal health, you know, so fewer maternal deaths on trend, when we spread that out across the districts, rural districts tend to do a lot poorer. And the result is that the services aren't always accessible or acceptable for the people in the way that it's delivered.
Yep.
So when we deploy these new healthcare workers, we really need to think about what are the main areas that will have the biggest impact on getting the health system in the right direction.
Absolutely. Thank you so much for speaking to us this evening and weighing in on this very important aspect. Rural Health Advocacy Projects Executive Director Russell Rensburg.